Hello guys, how's it going? Hello YouTube. Let's get TikTok rolling. Hey TikTok, how's it going? Good to see you guys. Hello. How's it going? Hmm. Stickers. Oh, they have some stickers that are different. I didn't even know these were even here. Those are so cool. Q&A. That's so cool. I like that one. Let's move it up here out of the way. All right, hey Baking. Hey Dar. Hey Anna. Thank you for the share. Hey MK. Thank you for sharing the live. That's super helpful. I am back on TikTok. I did come back about 20 minutes after on Wednesday's live, and after the appeal, and they approved me to come back on. So, but the whole live ended up being on YouTube. Hey Siobhan. Hey Rose. It's one of my favorite names. UAE. I got lots of UAE students from time to time, so that's awesome. So glad your teacher and everybody that goes there let y'all know about me and my lives so that y'all can come back in. While I'm waiting on people to show up, I just wanted to work on a few of the 2023 book prep notes. If and when you ever get your Hitpix book, let's make sure we actually know what the acronym stands for. So I always just fill this out because I get super nervous on exams. I am actually a really terrible exam taker, especially in a public setting. So I like things that I absolutely know, I forget. So, I mean, like my kids' date of births, even my own, I forgot when I went in to take my exam because I was all prepared with my AAPC ID number, my membership ID number. I was prepared with all this other stuff, but no one said they might ask your date of birth too, and they're going to need a copy of your driver's license or at least to look at it. And when she asked what my date of birth was, I just kind of looked at her like, well, I don't know. Because I showed up 20 minutes ahead of the exam, but that was super late. Like everybody else was already there, already seated. There was no spots available except for in the front of the room. So it was really intimidating as it was. So if you go in person, show up at least 45 minutes early in the parking lot. As soon as you see the first person go in, you go in too. So anything that I know I'm going to need to know, even if I know it verbatim, I go on and write it out just so I have it, so that if I'm super nervous and having brain fog, I know where to turn in my book to at least verify what I think it is. One time I forgot an abbreviation for Hitpix on my quiz for a medical assistant. Yep. It sincerely can happen. And they will also leave the first one the same and the last one the same, but one of these ones in the middle, and I think it's the common that they mess around with. And they put very close words to it, so slow down for these and really take it baby steps and do one at a time and verify that you really picked the right answer, because especially when they're similar like this, and you have answer A might be common, but then the answer B might be something super similar, it can get you all messed up. When do Hitpix update? Just like with CPT, they may ask you, when do they update? I go on and write it right here on my very first page. It is on like page 4, somewhere around there. They'll have this calendar of when it updates, but I like to put everything on the first page like I do with the ICD-10s and stuff like that. Ooh, I switch this book around. It's definitely not there anymore, or at least not where I thought it was going to be. Haven't even looked at this book yet. See, last year it was on page 7. It was on page 7. It's definitely not on page 7 this year. So they're always moving stuff around. And then they put the anatomy. What they do? Just take it completely out of there? They must have. On page 7 of last year's book, they used to have this calendar that you could look up, see when they update. Page 11 last year. Instructions on using this book. So yeah, it's still there. It's just on page 10 this time. But it's not like what it looks like on this CPT book. It's this thing. But they do update quarterly. And I think it's just easier to have it to where you can find it all on the front. Level 1 codes, sorry about that, TikTokers. Level 1 codes are our CPT, you see here we are at level 2, right? Level 2. So CPT is level 1, which is handy to know. And then our level 2 codes. Thank you for all the hearts and tapping the screens. Thank you on YouTube for the thumbs up. Hey Linda, hey Katrina. Hey A1C. Good to see you. Hey Patrice. Good to see you. Hey Missy. You just started school for AAPC or for billing and coding. Bless your heart. I don't want to do billing. Any suggestions on what to go for after CPC? Sure. I like CPMA auditor because, of course, you know, that's what I do for a living. I love medical auditing. And then also CRC. A lot of medical groups are looking for risk adjusters. So risk adjustment, you can't go wrong with that. It's one of AAPC's popular certifications right now too. A lot of people are trying to take it. but I like CRC and CPMA. Now, being a specialty cardiology coder, you know, they have that like CCC or something else is pretty cool, or ambulatory surgery specialty would be really cool. It just depends on what you're, what are you into? What do you want to do? Hey, baking, good to see you. You know, put whatever you're passionate about also in there. What do you like coding? Or what is your most difficult one to code and you hate coding it? Then pick that specialty, because that way you'll force yourself to get really good at it. Depends on your personality. Also, go through like Indeed and do some word searches for each one of the certifications that AAPC has. See which one comes up with the most returns for most job openings. That would be an excellent little Excel spreadsheet to make if it's CRC or CPMA. How many job openings are there? You know, that kind of stuff. If I had the time, I would do that. That would be a great little thing to share in our Discord. Just listing out the different types of procedures or codes. This is AKA ambulance. Whoops, B, venue. Or DME. Yeah. Which is AKA prosthetics, orthotics. Just any kind of code that is not in the same jurisdiction as CPT. And I've seen that word in a practice exam question that may have come from the certification exam. They ask, you know, it's in there worded some kind of way, and the answer ends up being the one answer that has anything that is not in the same jurisdiction as CPT. And that ended up being one of the answers. Let's see. The right here under lab and path, I always put like there's also, because it's hard to find, reading the results of a TB skin test. Those little things they used to puncture your skin with, you come back in 2 days to see if you have a lump underneath your skin. Yep. Those things are hard to find, but they're always in there, right around there. And then that's just where I write it, just so I don't forget in case I need to know it. And then the other thing, let's see, page 7, but this is the AAPC version. Let's see. Right here at the bottom of page 7, a lot of times they'll ask about when did this whatever go into effect. They love those types of questions. So right there, the bottom of page 7, and we could move this over to the front of the book, that front page. The Balanced Budget Act of 1999 has a lot to do with Hitpix, and just knowing that year and name of the act is super important for the CPC exam. And then, like I said, on the bottom of page 10, that last little thing that I like to mark up is when do codes become effective, and then when do they go into effect. That's super important for their quarterlies. The dates change based off which ones they're doing. It's when they go into effect. Yeah, super cool. I won't get to all the messages. Sorry, guys. Best way to self-study for the CPMA or the CRC. So get the study guide. Just like with AAPC, the CRC or CPMA does have a study guide. Get prior year. It doesn't matter. But find you a cheap study guide if you can, but it has to be the official AAPC one if you're going to take the AAPC version of those certifications, of course. That one will have a lot of information in it. I have a PDF version of one of them from one of the courses that I took last year, but that meant going into VitaSource and copying it'll only let you copy 300 words at a time and then paste it, and then copy 300 more and paste it. I went through and copied the whole dang thing because I knew I was only going to get access to that for 6 months. But geez, Pete, what a task. So any printed version of that would be great. And then the practice study questions that AAPC sells. Buy all of them. If you decide to do risk adjustment, AMA has a great book out. This one's really cool. It's for risk adjustment. I'm hoping they'll come out with another version. This is the 2nd edition. It's from AMA. You can get it in electronic format or you can get a printed copy. Whatever. It's about $80, but man, is this thing good. And if you get this, don't worry about the study guide from AAPC. This will have everything in it that you need. Plus, it has a lot of study questions in it too. Tons of examples. The answers you download from the internet, from the AAPC website, somewhere else. But because the answers are not in the book, but they give you the instructions on how to do that. There is practice exam questions, of course, at the end of each chapter. And then there's also true and false questions and think out loud ones too. So where you have examples of clinical charts and they might tell you to do this example and then it'll be in the chapter and then they'll tell you what the answer is. But you download those answers somewhere else. It tells you in this book where to go for the answers. Right there. It tells you to go to that link right there and download that, the answers to the book. So that's just, it's kind of interesting that they don't put the answers inside the book, that you got to go to one other place. But it's free. You don't need to do anything. But you got to buy your book, I guess. You know, you need this book. But this book's really good. I like this book. It's wordy. It's a lot of wordiness. They could have cut down on some of it, but whoever Sherry is, she did a great job of doing this book. So it's awesome, but it's a bit wordy. I think I've made it through 3 chapters so far before I went, oh, okay, I know enough about risk adjustment. But definitely get the AAPC study questions and that's super cool. All right, we can put away our Hitpix book for a minute and we'll get started on some practice questions. I have, don't forget too, while I'm on here, that if you do not have the ICD-10 and the AA and the Hitpix book, if you don't get them from AAPC or get those versions of the book, even if you get them from Amazon or from a bookseller, you don't have to get them from AAPC individually because they'll charge you $25 to ship them to you individually. But there's tons of bookstores and stuff that have them. If you get a Hitpix and an ICD-10, I still highly recommend you get AAPC's version. They have a lot more appendixes in here that other versions do not have, that they may ask you questions on. You even have, let's see, let me get through here. The general correct coding policies appendix, where some questions do come from on the exam. Then you also have, it's a short little document, but it's good, the 100 publications from CMS on how to bill certain things. Like one of the questions I think they had was about how much do they pay for nursing services in some sort of way. It's really interesting. I got it marked in my last year's book. Let's see, vaccines, immunizations. There's also one about the, not infusion, but dialysis and hemodialysis. How much or who got implemented on these. They do have some examples, but this mess is a lot. It's a lot to read. They have the how to code for telehealth services. It's a lot, but some of their answers do come from here. But it's hard to go through this and find it. I really like getting the electronic version of this book so I can control F and then go search where are they talking about payment methodologies for whatever. Where is... I'm trying not to be too boring. I know I've been pretty boring lately, so I'm trying not to be boring. But I feel like I'm being boring right now, so sorry. Just want to show you one of their questions that they had in the back of this book. If you already have an opt-in book and you already have and you decide you want to get an AAPC version, you can take both of them versions with you during your exam. So, where is it? It's under 100.2. No. Chapter 15, though. Don't even know if I have it in there this year. Let's see what else comes wrong with it. Boy, these are so hard to find. 102, 15, 201. Okay, it'll definitely be more. 230. I'm looking at those headers for the 15,200 something. 232. Right there. For the cardiac rehab services, how much do... Oh yeah, what's included in cardiac rehab services? What's included? They have these bullet points right there at the bottom that are important. Also, where is it? right underneath those bullet points is right here, these things. This page right here, right underneath this chapter here, they have physician prescribed exercises, the cardiac risk factor modifications, the psycho assessment, the outcomes assessment, the individual treatment plan. Those 5 things, one of them was like, they had 3 of them gone, but the only one that was true was the psychotherapy assessment. And they just wanted to know is that if you knew that during cardiac rehab, after like an intensive procedure, what is supposed to be provided for the patient, that you would be included in it. And that psycho assessment would be, so before and after they give heart transplants and stuff like that, you have to go through all these steps and it's all global and included. So that's the one that they picked on the exam. And that's the only place to find the answer unless you know billing guidelines. But AAPC's Hitpix book is almost 800 pages thick, which you can tell it has a lot more added info in it. But for today, I got practice questions on ICD-10 first. Then I've got CPTs, of course, with some E&Ms and stuff. I wanted to do some notes for 2023 book while I was doing these questions with you guys to show you how I do notes and prepare the new book for the new year. So I do have some videos explaining some more about, I did the first 10 pages of the guidelines on YouTube, which is part of your membership. If you do buy your membership, it's there. Plus, I showed you how to do the external causes index on that video, where you mark up the indexes to show you which ones are place of services, which ones are to see if your patient was, what their status was, were they a volunteer, were they whatever. But that video includes all of this makeup and how I color coded even the index with it, which is really kind of cool. But today I wanted to show how I do individual diagnosis code noting for my top 10 diagnoses. If we have any questions today for anything with blood disorders, anything with sepsis, HIV, pneumonia, pregnancy, OB, adverse effects, and your hypertensions and your CKDs, then I want to show you how I make a note. That's why I don't have the electronic book open right now, because I wanted to make notes while we were in the book. So I hope that's okay. Haley, no worries. I haven't even really done much. I got into the Hitpix book and did a couple of notes in there to show you about what's going on in the notebook. But hopefully I want to make sure I give you guys good value and it's not boring. You want to schedule? I know, MK. I just don't have any time right now. It's crazy, MK. I know you do. My kids are home even Monday. And it's so hard doing the extra class on Fridays. Plus I have the 3 classes Monday, Wednesday, Friday to prep for. And then I'm trying to make notes and get these things out. So it's plus the full-time job. So it's really busy for me. All right. Let's go to our first practice question for tonight. I know the YouTube people have already been looking at it. Let me holler at my kids real quick. Abby, are you good? y'all helping her out? James, are you making her put away all of her stuff? My kids weren't helping my mom. I could hear somebody banging around in the kitchen, and my mom's putting away groceries or something, and both my kids are ignoring her, letting her bring in all the groceries by herself. They're so lazy sometimes. Gotta love the 13-year-olds. All right. When I am thinking about these codes, the J codes, I think I'm thinking about respiratory, right? A, B, C, D, E, F, G, H, I, and then J. Is that respiratory? That is respiratory. And then B codes, I'm thinking about blood infections or something like that. So we do have a lot of guidelines with both those areas, so we do need to be careful. If I'm looking at this question for similarities, what I would see first off the bat is that we have three of them, right, that all have that B39.2, which is the only real thing that is like identifiable as far as similarities, because this is J17, J12, J16. They're all under different things. So is this, but the B39.2 is there. So that's interesting. What do you guys think? Oh, YouTubers can't even see this. What happened to YouTube? What did I do to YouTube? There we go. How's that? There we go. Sorry about that, guys. Y'all holler at me. Y'all can't see something. Well, I wouldn't pick C for anything because it doesn't have that B in it. So this is a different, I know y'all are used to looking for similarities in the very first numbers, and I tell you not to look at the backs. But this one, all the first numbers are all different. If you only look, the only thing that's similar is the J's, of course. But the back number has some similarities. So C I would exclude from anything just because it doesn't have the B39.2. So before I run to my book, I would just eliminate C, and then I'd see in my question the last sentence, because remember, patient may come in for a bunch of symptoms, what have you. They may have a whole history of stuff in the beginning of the question, but all I need to know is what was the final answer. What did the doctor say the patient has? That's usually at the bottom of the question. So I'm going to just look for that. Let's see. What would we code this patient with? Histoplasmosis pneumonia. Is that 2 diagnoses or is that 1 diagnosis? Your question is deciding whether you have 1 diagnosis or 2. Histoplasmosis. What's going on with histoplasmosis? Where is that located? Plasma, meaning blood. So does that histopneumonia technically, of all things, really mean a respiratory issue, or is it a blood issue? Wayne's just killing it over there. Sorry, MK. Let me see if I can't get this to show better for you guys. Not really a lot better, but not really. My cranny thing gets all up in the way. But every time I adjust it, it ruins my YouTubers. So that's not going to be helpful. There we go. Sorta. There we go. Histo means blood. So technically, if the pneumonia or infection is in the blood, we probably will only be billing the B, or at least the B would be first if we were going to have two diagnoses. And since we don't have that option, yeah. So be careful with pneumonia. It's not always going to be one of those where you're going to be in the J's. So let's go to our 2023 book and go to that B39. Let's check our answer first, though. Make sure. Yes, we are right. We are right, D. So B39. I know I don't have anything written in this book. 39.2. Oh, I got shade in here. 39.2. We have an example of pulmonary histoplasmosis capsulated. Ooh. Yeah. And then we can just, how I do these is I turn my book sideways. Sorry, guys. And then I just write the example. Example. And then I underline it. B39.2. Equals. We had a patient that was simply here for follow up histoplasmosis. Probably don't have to spell it all out, but I like to spell it out the way that APC has it written out on their exam question. Histoplasmosis, pneumonia. Pneumonia. X-ray showed 50% improvement. That's all. Super, super simple. Just a couple of little words. That way, if I ever end up with histoplasmosis and pneumonia, I've written it physically out somewhere, and you'll have a better chance of remembering stuff like that when you get down to your exam. Ooh, I wrote that somewhere, and you'll know to go to your codes and figure it out. let's go to our second question. Oh, we've got some T codes. T86 is the first code for everything. So we just need to know, technically, since it's in all three, I wouldn't worry about going to that code because I know it's an injury. I would get rid of B, right? I just need to know these all have the same 80 code in it. Would I code the C22 or not is going to be my first thing to eliminate. And then the second thing that I would eliminate is, do I need a Z code? So what's our C22? Let's go to that code first, actually. So ABC. C22. The next one, you guys are going to tell me where we're going to go first. And I'll let you know if I agree with you or not. C22. I wish this would focus. I know you can focus a whole lot better than what you're doing. C22 is malignancy of liver, intrahepatic or bile ducts. Point O is liver cell carcinoma. So if this patient has liver cell carcinoma, we know we can not only get rid of B, but we can get rid of C too, okay? That will be helpful. Does that make sense of how I'm doing this? So you don't have to worry about that complication. BJ, what products are you talking about? The Hitpix book or in CPT or in ICD-10? I just do a Google search for a few days and then change my Google search to shopping and find these books the cheapest way possible. Once you get the books, then you join in on my lives. I teach for free Monday, Wednesday, Friday here on TikTok and on YouTube. On YouTube, you're getting a dual screen where you're getting to see my book and the question. So if you happen to be on YouTube, you get to see those at the same time, which is kind of handy dandy. But the replays are also available on YouTube for free. So all my 200 plus classes that I've done for over 2 hours are all there for you to do replays with. But it's funner to do them interactively with your books and make notes and stuff like that. So yes, I think I'm the only one that does a lot of classes every week for free for you guys. I am just one lady though, with a full-time job, 3 sons, and my mama living with me. So I do this just to help you guys out. I saw too many people suffering during COVID, so I wanted to do something to give back. Plus, I'm already in my 50s, so I'm getting older. And this is just my way of helping out and seeing what I can do to help people out. So yes, it's all free. I don't charge for my free lessons. So y'all get you some books, do you a Google search, find you a place that will ship it to you for free. I like the store Book Run. They're really good about free shipping and getting you these books for free. So let's see if this patient has liver something. I already forgot what it was. It's what? 22.0, 22.0. Liver cell carcinoma. There you go. So let's see. I can teach you to get certified the cheapest, fastest way possible. We're just skimming. Do they have liver cell carcinoma? Ooh, this is a tough one. Because it's not saying the same exact word, but it's saying hepatic cellular carcinoma. You see how they change up the words where they don't want to say the exact thing that's in your book to confuse you? This is how they get you. So again, in our book, we're going to write an example that our 2.0 can be. Travis, go away. No.
They call it disgusting.
I'm teaching, baby. What is?
This.
It is not disgusting. It's beautiful. I love it. What does it say?
Black. Wait.
Bold? No. What does it say? Oh. Can I show TikTok?
Fine.
Can I show TikTok? Hold on. Hold on. Travis got a new shirt today from Target, and it says, bold, black, and bougie. That's my baby.
No!
It's cute. It's cute. That's my baby. That's my baby. Okay. This says, Target's so funny. Okay. Hepatic, H-E-P. I can't see through all my cameras and cranes. H-E-P-A-T-O cellular. All one word. Carcinoma. C-A-R-C-I-N-O-M-A. Yeah. Now we've got a note in our book. I just wrote that that code equals that word, those two words. So I know I'm going to need that 22.0. So I can get rid of C now because it doesn't have it. B we've already gotten rid of. Then we just need to know, do we need a Z code or not? What is our Z98? Isn't that how, it's awfully how they play tricks on you. Hey, Nana, good to see you. Thank you for tapping the screen. Everything is under medicalcodingbyjen.com. You can go to my website at medicalcodingbyjen.com. Go to your social media tab, and I've got everything listed there. The other thing that you must join is download the Discord app and join our Discord, because I have tons of other free material there, and that is super helpful. I have all these practice exam rooms with practice exam questions, what to expect on exam day, how to get all the books updated, and tons more. 24-hour help in there. If you have a question, go here and ask. Somebody will help you. But yes, all my YouTube channel and everything is there for clickable links. Yep. So now we're down to two answers. Our Z98, right? Z98. So just bear in mind about me helping you out individually. One-on-one is rough when I've got almost 20,000 of you. I'm doing my best to create content and give as much away for free as possible. I'm trying. I'm not tooting my own horn. I'm just get some complaints from time to time and just asking for a little kindness. I'm doing all I can. I'm trying. All right, Z98 is, and I know I'm horrible at getting back to everybody on messages or emails or anything else, and I feel terrible about it. Z98 is post-procedural status. Would we code that on this one? Hey, Katrina, Rachel, Liz, Denise, Linda, Patrice, Juan, Siobhan, Rose. Come on, YouTubers. What do you guys say? Y'all got the better view. You got the book and the question. How would we answer this one? I'm kind of waiting on YouTubers to try to answer it, see if they can answer it. What do you guys think? Yep, we do have a guideline. That's why you always stop at the first 3 digits. Z98, stop. See if there's a guideline. There is one. It excludes post-procedural complications, which is what they consider cancer after a transplant. So next to this guideline, next to Z98, because it's not 100% clear about this guideline, but it does tell you that there is a guideline, we're going to put example cancer after transplant equals no Z98. Yep. Because they consider that just a T code, which is your injury code. So we know we're not going to be billing the D. And A is our answer. And there's your fancy rationale if you feel like reading all that mess. Oh, it's okay, on. She's grocery shopping. Well, I am showing you the books, but there is a guideline tied to this. So if you don't have those notes written right in, that is super handy dandy to write it in right next to there. Super helpful to do that kind of stuff. R codes. All right, guys, y'all's turn to do this question. Even without the book, it's okay. You can answer this one part. What answers are we keeping? What answers, if any, are we throwing away before we even look up anything? Good job, Charisse. Sorry if I butcher anybody's name, too. Aw, thanks, Wonder. Our Wanderer Spirit. I'm trying so hard to make the 2023 notes even better. Just full of all kinds of cool stuff. Yes, y'all get to know each other. I would like to keep, if I was doing this, the 2 with the 55s, because they're both the same answer, right? Can't draw a straight line to save my soul. They're the same answer. Pay attention when they have the same answer written down in two answers. There's a reason for it. All they want to know is, would you code an S code or would you code a Z code for this patient? They've already done the first code for you. So I would eliminate B and D. We can't tell from our throwaways whether we would bill the S or the Z because we have both of them in our throwaways. So we just need to think about what's going on in each one of those chapters. S's are external causes, which means something happened to the patient, right? That's injury, poisonings, and that kind of stuff. All I'm doing is looking at any sidebar in any of the S section. And then Z's are the status of the patient, like history of, those kind of things. So let's just see, did an injury happen to the patient? If it did, we know we're going to do C. If we're just doing a status on a patient, like history of, we know we're going to do a Z. So try looking from the bottom up. Yep, she's got syncope episodes. Is that an injury or a status? Z91 is risk factor not elsewhere specified. Let's see, 81 is probably to fall. This 91. But they don't even know. She has risk of falling. There's a guideline to it too. So if you're on Z91, they're pointing out that you have an official guideline at IC18D. Woo. Right there. IC, where am I at? 21.4. Which one did I do? I did the wrong one. Yeah. 981. Yeah. IC21C4. And y'all know those guidelines are up there in the front of the book. So we're looking for, I can't remember those numbers. IC21. IC. Those things are horrible to find. $21.4. So G29, oh Lord, maybe if I'm coding it right. I don't know. I'm not too good at looking up these guidelines individually. I like moving them as I'm writing them to the codes, but looking them up is rough. let's see, we got 21. Then what else were we looking for? 21 something. C4. Oh. C4. Where's 4? Where's 4? History of C4. History of falling. But right here, it's on that page. Sorry, I just now got to the thing. But up here, I bet it has some sort of exclusion. Not receiving any treatment. Reoccurrence and therefore may be required. Continue monitoring. Explain a patient's past medical history. Not past. She's still present. She's still having present issues of falling. She fell once, but she failed again current, right? There's going to be some sort of guideline exclusion for that. I don't think we're going to be billing a Z code. I think we're still looking for a diagnosis, and we would do the SO6. So if we go to our SO6 stuff, she fell one time, but she currently just fell. But that's not, they don't even know why she's falling. 6.0. She's probably rebooting. She has a concussion. Concussed. Did they diagnose her with concussion? This is what we've got coming up with the SO6s. And he did give her a minor concussion. I like a Shakir dynamic, or yeah, pretty cool. It's not going to be A, my love. We're not going to be doing A because what she was diagnosed with was her symptom of fainting and a concussion. She has not been diagnosed as a fall history thing. That would be used during like a wellness exam. And they were going over her risk factors, and they might diagnose her with histories of falls. But right now, they're treating what happened today, which is her laceration on her forehead and a minor concussion. They're just discussing the rest. User 495366. She said she just can't pass. She's been coding for 30 years. You really can't blame yourself for that. Thank you so much for the quiet girl, for the gifts. That's so awesome. That coding history and coding for the health plans is what's got you not getting the right answers. This exam has nothing to do with coding. I'm not coding anything. And you should not come to this exam with a coder's point of view. You need to get rid of all that payer information. You need to take it answer by answer and eliminate them and find the correct answer the most correct answer. I find a lot of these answers are totally incorrect for how you would bill certain payers, certain health plans, or even guideline related current today. You would not do some of this stuff. You need to pick the best answer based off the bare bones basics of what the codes are told to you and their meanings out of the book. Yep. Be sure and join in on my Friday classes. I have Friday classes 8:30 to 10:30. They're for advanced people that are just trying to pass the medical coding exam. And even if you can't participate in it, you can watch the replay. Those are super helpful to show you the tricky parts that they're confusing you over, if it happens to be guideline related or a particular type of situation that AAPC loves to pick on. They're really cool. We did one today. It was really cool. So you just go to my website and go to medicalcodingbyjen.com. Just go to the workshops and tutoring, and it's just my little workshop for the repeat exam class, and it's just $5, and it's specific to you guys. The questions are super difficult. I did some COC stuff today because somebody was asking for those, but they're more difficult, of course, questions. I do have a group workshop this Sunday, which is going to be 3 to 4 hours long. It's for everybody. I'm working on PowerPoint presentation and, of course, some charts for you guys, like this one that y'all can't see on YouTube, sorry, but I'm taking the codes that if they were deleted in 2023, like observation 99217, what would the code be for 2023? Just a simple basic chart. What if you had a code that you know you would have coded in 2022 for 218? What would it be this year? So that's added to the PowerPoint. You get the replays of these workshops too. If you pre-purchase and you can't stick around, what I'm going to do this one is to show you all 17 sections of the CPC exam, what kind of notes you should have in your books for that particular area, and then a couple of tough questions in those 17 sections that we can go over. I'm going to try to do it all in 3 hours. It might run to 4, but we're going to do just a good overview of the entire exam and what to expect. So I'm working on that right now. Oh, get rid of that, and let's get down here to our question and show off that answer with our guideline. It is A with this one, not the concussion. Y'all are right. Why do they say it's the concussion? Let's see. Therefore, should not be reported. Wait a minute. I think I wrote down the wrong answer. Yeah, I wrote down the wrong answer. Sorry. That's my bad. I gotta watch myself. I get moving too fast. I'm like, wait a minute. I know I saw this before. Okay. So we can see that the rationale does say that it should not be reported. Anyway, too funny. I don't know. I got too many ducks in a row messing around here. Let me move down this one. And I did not cover up this one. So what's our ends? We've got 2 of those. A, B, C, D, E, F. Ends are diseases of kidneys, renal area. Okay, and then we've got an injury code, and then we've got a symptom. What was our diagnosis? Was what? Just blood in the urine? Blood in the semen. Ah, okay. That's all we have? Presence of blood. How would we diagnose this one? Doesn't look like we've got too much of a... Thanks, go-kart. Hey, Jen Jen. Yeah. Thank you, Quiet Girl, for all the stuff. You're awesome. I'm just trying to go back through chat and see if I missed anything while y'all are working on this question. I saw somebody earlier with a question mark, but somebody, yep. The Q&A is too much in the way. Let me see if I can fix that. Stickers. That is a pain. What is that? Showtime. That's cute. Let me get that one. There we go. There's a heartbeat. All right. If it is, thank you for the chill. You're awesome. Do we have a diagnosis? Think about that. Do we have a diagnosis? Patrice, do we have a diagnosis? Would we go to the kidney section and diagnose this patient with anything? Do we have an injury listed? All we have is blood in the semen, and that's actually just a symptom, right? We don't have anything else. So we would pick B for this one. That's funny. Yep. All we're doing is confirming whether blood is in the semen or not. And the patient will need to follow up for further testing because we still need to grab a diagnosis. That's just an idiopathic condition that may resolve spontaneously or on its own, but it's maybe an underlying symptom of a disease. So we need to look and go there. There you go. All right, more injuries. What's our differences between the S83s? Those are external causes, and the M's. M's are diseases of the musculoskeletal system. So I'm just turning to any section, just reading the sidebar right there. So we're going to see if this patient has an injury or a disease of the musculoskeletal system. So let's check out our question and see if we have a disease or if we have an injury. What do you guys think? One says we do have a diagnostic. User 96 says injury. Yep, we have injury codes. So I would get rid of any of these diseases. Yep, I would get rid of those. Then I'd just go see what my difference is between my 11 and 00. So my 200 is a bucket tear, and then my 211 is also a bucket tear. What's my differences? We got right knee, current injury. One of them says unspecified meniscus, and this one says medial meniscus. Am I medial or unspecified? Do we know? Yep. Mediofemoral condyle. But our code just says medial meniscus, but we could write that down. Example, right, of our 111 equals MEDIO dash femoral and condyle. YLE. Y. There we go. Just something like that to help you recognize it later on. Plus, it reinforces what the exam question was trying to teach you by letting you put that in your book. You could also put something down about if it's this one, it was due to recent injury equals no M code. Also put down next to it. So I was just writing just that. That's all. And then I underlined it. That's it. Just reinforces the question. Helps you guys out to remember this kind of stuff. And yes, A is our answer. I swear I got some CPTs up here coming up. I'm going to skip this one because I'm tired of doing diagnoses. That's another one. We'll do it at another time. That's another one. Oh, Lord. There's some CPTs. Let's get out our CPT book. I know y'all missed this thing. How much more time do I have? Good. Okay, good. I got 45 minutes or so. We got 741s. I don't have that section done yet, but I do have things highlighted. Hopefully pretty much what we need. Things that I do in my CPT book to prep it, of course, are a little different from everybody else. Since I teach from the exam point of view, I only make notes from the exam point of view if you need it. So I underline and double star in red any do nots that are underneath each codes so that I remember to go look here to not code this code with any one of those codes. I highlight if a CPT code has these parentheses things in it. Not every code will have them, but if they have it, I highlight it in yellow. And if a code has any do nots, like, what am I pointing at here? Y'all can't see it on YouTube. There we go. This one says without way over here, but next to the code it says contrast material. I put one line through it when it says just without something. So that's, I don't have to see it. In our little chart right here, these are all, that one is without contrast. So I put a line through it. The other ones are with or without. So this one says without too. So I got rid of that one. But that's what I got so far on this book. So we're looking at these codes. Which ones would you keep and which one would you get rid of? Just based off of them numerically. That's all. Thank you, Micah, for the roses. I started getting stars on YouTube. That's been really kind of fun. I don't know what's going to happen with that, but I'll toss it in there. Oh no, it was stars on Facebook. I don't know what that is, but people have been given the stars on Facebook. That's been cool to see. Y'all like A and C? I do too. Those are only one number apart. So I love it. So let's get rid of these two. And what's our differences between our 77 and 78? So 4177 and 78. They're both child codes. So we've got 77 and 78, I think, if I'm in the right spot. Yep, page 532 here in the 2023 book. This one's without and with contrast. This one's with contrast. So just knowing that particular thing, maybe that'll help. Let's go see if we had without done and with done. Did we do the test twice or not? I was sitting here freaking out because it said oral, and I know oral does not count as contrast. But then I forgot to read my and. We do have IV contrast. This particular bird, if it only said this, then our test would only be without contrast. But because they do have the IV contrast, then it is with contrast. So, yeah. They're trying to confuse you. Because if you know your guideline, you would say that this is without contrast, and then this is with contrast, without and with. But I think they gave them at both the same time, the way I'm reading it, and did the study after the patient had both of those contrast at the same time. If that makes any sense. Now, if they did the study once with oral contrast, then repeated it again, and did the study again after they administered the IV contrast, then that would be your 78, if that makes any sense to you guys. But yeah, there's your answer. Did y'all notice on YouTube, I've got these fancy little bordery things that separate the book and the camera view with these rotating rainbowish kind of colors? You don't know how much trouble that goes to create. I had to create a video of that in 5-second loops to format around each screen and then import it into OBS and learn how to, my goodness, my brain is just learning all kinds of new things at its old age. That's so funny. Just to be able to do that. That isn't something that you can just click a button and have magically happen. You have to like write some code for and learn how to import it and stuff. It's quite highfalutin for sure. All right. I'm just going to let you guys see the question, and I'm going to see what you guys think the answer is. I've got to adjust the size for the YouTuber. Sorry. Hey, somebody on YouTube, what do you think the answer is? What do you guys think it is on here? What's your rationale? Y'all are keeping A and B, I see. And then what are you going to do? You just need to know whether you're adding radiology or not. Thank you, Fortnite. Good to see you. I like your thinking, PB. I have one person who got it right on, no, two, on YouTube. Rose and PB and Patrice got it right with the answer C. So, you guys, if you're looking at your codes for OO, you would see that it's an introduction of a catheter aorta. What did your question say that you did? You did a catheter that was selectively catheterized. They're being the devil again by not saying in the correct format that it's a selective catheter placement. Selective catheter placement is coded differently than just an introduction of a catheter. That's not selective. And it'll say here to go somewhere else.
This one. I just
My
called
Travis come in.
So,
What?
you know how
Baby, is this
she
so
went out
important?
to get, she brought more germs back home. She's literally out, people surrounded by children, and I was like, oh, great,
I'm glad
more
she's
germs.
having fun. Please leave, my love.
No, I'm not gonna be able to go over it.
I got 30 more minutes until the live is over. I love you. I love you. Okay. So, we're not in this 200. And what I would write right here is if example says cath to selectively cath ET ERICE. What am I going to say? No to that. Do not code if it's got those wordings on it. For that one right there. So we would have known to get rid of A and B, and we could go look at our 52 and 51. So 62, 51, and 52, mama and a child. Are we unilateral or bilateral is the only difference. How did we go into the body? We went in on the right. We didn't go in on two legs, two femoral arteries. We only went in on one leg. So we know we're unilateral. That's your differences with these. All there is. And that's how you come up with this answer. You don't have to worry about angio, renal, none of that. Remember, MK, you're not looking up anything other than your differences between what the codes are. And the only difference between these codes is unilateral or bilateral. We didn't need to look up anything about angio or nothing in those questions about any of that. Only look up the differences between the codes. Because you're going to get yourself turned around going in here thinking about angios and whatever else they're worrying about. Yep. The first codes were catheter. So we just needed to make sure that we did just an introduction of a catheter in the aorta. So when I went to find the catheter word, I looked a little before it, a little after it. When I saw anything that said selective, I know that we're in the wrong code because that very first code, the 200, is not selective. Everything else after it is, but that one particular code is not selective. So I knew to get rid of those two codes, and then the only other difference I needed to look up was unilateral and bilateral. The rest of this question don't read. You don't need it. It's going to make you fail those exams. Just stick with what the codes tell you to look for, and that's it. You're not a coder. You are not coding. Don't code. It's going to get you in trouble. All right. Again, I am going to show y'all the question and the answers and let y'all battle it out. Let me see. Can I do a poll? Add one. Are we 11? We're going to do a smiley face, right? Or if we're 43, we're going to do crybaby. Kind of, sort of. 11 or 43. So y'all can, TikTokers can click on that poll and answer. Are we 673, 11 or 43? Let's see, 6. On YouTubers, are we the 11 code or the 43 code? Ooh, y'all gotta be faster than me to get to these codes. So we've got our header over here for the 11 header, and then our header for the 40, 43s. What's our header for those? Vertical muscles? Are we extra muscles or vertical muscles? Which muscles are we? What do you guys think the answer is? Patrice says we're keeping the 43s. Cool beans. Let's see. We get rid of those. Then we just need to know, would we add the 332? 332, which is an add-on code over here for that surgery. Does C have everything in it already? C is way down here at the bottom. Does it have everything in it that we did today, or do we need to add the 32, which is at the top? Thank you for tapping the screen. I've got 18,000 likes and 11 shares. Y'all are awesome. Normally, a lot of times, usually on the CPC exam, 80% of the time, if it's just a difference between having one code or two codes, the answer is usually always one code, right? They're always trying to trick you into billing the extra code. So all these that have the use this code with that code, I usually underline and double star in green, which I haven't done in this book. There's a ton of them here in the I section. Just a ton. Patrice is right on YouTube, and yes, who was that? Raph. She is correct. That is a C. There you go. No additional services are needed. It was just an extensive scar release. We can move on. And 50% of you on TikTok got it right that we would stay with the 43s. What's the difference between that and the 11s? The extra, I forgot to say, the extra or the vertical muscle. What muscle did we do? Extraocular muscle and the orbit's contents. What was the 11? 6'3". 11. It does say extra. How did we move from the extra here to the 43s? And the 43 was underneath vertical muscles header. Because it ended up not being anything to deal with. They're both extra. See, this one is the mama code is also extra in the 40. They're all under extra. The blue header only changed to horizontal and vertical just for those pictures, which had nothing to do with the codes that were in this area. The pictures didn't change your header. Oh, that's cool, because we're still under the extra header. We only picked the 43 because it was a release, and our question said that we had a scar that we needed to release. Yep. And the 11 is a strap surgery to fix your shape of your eyeball, because one of your muscles is usually tighter than the other one, and it can make it like egg shape instead of round shape. So we didn't have that surgery. We just had a scar release. So I pointed y'all into the wrong direction on that one. So that was probably my fault. Go. All right. Remember, let the codes tell you. What codes would you go to first? Go look up those code descriptions first. Look up your differences. And then look at your question. Don't try to rush to the question first. What are we doing? Which codes are we keeping? Just looking for numerical similarities. I like A and C. That's good. Hey, Susanna. Good job. 453. 45378. And then our other one is 86. 86 is a child code. We can't do anything with it. So don't look at that code descriptor. Go find its mama code. What is its mama code? Its mama code happens to be the 78, which is our starting point. So everything that's in 78 is also in 86, except for 86 has the balloon dilation, where 78 does not have the balloon dilation. So we just need to check our question to see if we'd had any expansion device mentioned at all. What do you guys think? Did we have any expansion device at all? Good job, TikTokers. We got 19,000 likes and 15 shares. And you're getting it correct. Patrice, yes, correct on YouTube. We do have dilation of the stricture. So just look for that word dilation. Super helpful. Plus you can underline that word difference right there on yours 86. Be sure and look for that word. That's the one you want to go look for in the question, is dilation. There you go. There's a rationale. Ooh, E&M. Love it. We got some new guidelines with E&M. I'm not too happy about them going in and just really taking the questions that were already there and just adjusting them, because I think they hurried through some of them and made it not as good as it could have been if they'd have written new questions for these guidelines this year. But they've been selling the same questions as 2019 that I know of, pretty much. So they're good questions. It'd just be really nice if they really wrote some new ones. Anyway, when I see this question, I see two of them that are, ER visits. If you don't know, be sure and go to your 283 and learn that those are ER visits. And then two that are just musculoskeletal procedures. So we just need to see, where was our patient seen at? Let me get rid of this. What are we billing for today? Let's check out our last sentence on our question. The patient is to follow up with a medical provider, 7 days. So, appropriate code. We got a level 3 E&M visit. So that lets you know right away we're doing A or D. And we've got the 3 listed, so we don't have to worry about that anymore, or the modifier. We just need to know, was radiology involved in today's procedures or not? Was radiology included in this code, or do we need to bill it here? That's the only differences in these answers. What do you guys think? Did we need to bill radiology or not? The E&M notes are done and ready. If you guys want them, they're on just my website. I haven't put them on Etsy. Trying to keep them cheaper there because I don't have to pay Etsy fees. 99283. I'm already, no, 235. 235. I don't know of a lot of musculoskeletal procedures that include radiology. It's not something that I can remember or think of seeing. So I'm assuming if we did an x-ray, we're going to need to add it. Some of the cardiovascular and things, they have radiology included in them, but I don't know of a lot of musculoskeletal ones that do. So that 23500 is just a clavicle fracture treatment. So yes, it is D. But that's one thing to know about a lot of musculoskeletal. If they did radiology, it's probably not included and you need to go find it. But then in reverse, when you're doing any cardiovascular practice questions, they'll always pick the codes that don't tell you that radiology is included in that procedure, but it is included in that procedure. And you normally don't bill anything from the 7,000s. So that really does show you the difference between some of those chapters and things you got to keep straight during your exam that aren't really things you can write down as notes on every single page, but maybe at the beginning of the chapter we could write okay to bill radiology, and then on cardiology, the first page, we would write double check before billing radiology. Okay, wouldn't the difference between manipulation with and without give us the answer? Absolutely. I just think it's an easier thing to think about is adding radiology or not, because we can see that there's an x-ray in there. But yes, manipulation, did they pop it back into place or did they not, would definitely give you the answer. Since you're already in the musculoskeletal section, you don't have to think about going any further. But I wouldn't even gone to the musculoskeletal section. I know that I'm doing one or the other. I wouldn't have even gone to the radiology. I would have just checked out, did we do an x-ray? And if we did, then I would bill the one with the x-ray. But I wouldn't have even looked up anything in the 2000s. Once I figured out that we were billing an E&M service, got rid of B and C, I know my difference is radiology, looked for that word x-ray, said, yep, I got to bill it, and I would have billed that and moved on to my next question. That's how I would have done the question. Wouldn't even bothered with the 2000s, but y'all do it however y'all want. Let's see. This one. Thank you for the balloons. Those are so pretty. You're welcome. Ask away. So we've got two with the same answer. Hyper focus on those. Are we in the ER? Are we billing a level 4? What are we doing? If we are billing an 84, what's the difference? Am I billing 3 CPT codes or am I billing 2 CPT codes? What did we do today? What do you guys think is the answer? So are we doing, is that the one where they do the 1 or 2 person anesthesia? Or 991 in the back. It's in medicine section. One of the last codes back here. 991, 56, and 52. Yep. We don't bill these codes with anesthesia codes. I've already got that note written down. So our 52 or our 56, which is part of the 55. What's the difference between the 55 and the 51? They both start off the same. We've got moderate sedation, provider, other than. 55 is other than, is our only one word difference right there, where our 51 is the word same. So if we were doing C, we would have the same physician giving the sedation as doing the procedure. If we were doing A, we would have 2 different people. Could be a nurse giving sedation and then the MD doing the procedure. You just need to know who gave the sedation, and which one would we bill? This one's a bit tricky. What would we bill? Think about it. When the nurse comes around and she does your blood pressure, gives your meds, she hangs your IV bag, she gives you your chemotherapy, infusion therapy, are we getting bills for the nurse to do anything to you? Or are we getting bills from the MD who is doing things to you? Is the nurse working underneath the physician's scope of practice in this situation? Or is this person a certified nurse anesthesiologist, whatever that CRNA thing? If it had said CRNA, then yeah, that would have been 2 qualified people because that's in this person's scope of practice to do. But legitimately, we're not supposed to sedate patients. We give them sedation meds all the time, but we do it underneath the guidance and supervision of a physician under their scope of practice who is the one who bills. So this one, just because it said the word nurse and not CRNA, it's just, they're considered one and the same. They're working together. Very tricky one. They are a team that can be considered one person because she's not specifically an anesthesiologist. The other incident, though, that I've seen in this question is the ER doctor gives the sedation while the orthopedic doctor does the manipulation of the bone. That's two different people. But this two different people, just a plain nurse, a registered nurse, and the physician are considered one entity. So now knowing this, what's your answer? Good job, Rosalind. Now we got it. Good job, Nora. Soul, try again. We're looking for the one with the same physician. And 52 is the same thing as the 51 CPT code, which is the same entity. These two people are the same. Yes. Good job, Emily. Good job, Go-Kart. See how tricky they can be? They can be very, very tricky with this. Thank you for liking the lives. Got 21,000 likes and 15 shares. And that's it. I'm going to end it with this particular happy little question. I hope it was helpful for you guys. I'm going to go finish getting ready for Sunday's workshop. Got lots more stuff to prep for that thing since it's going to be like 4 hours long. If you haven't joined, there's still room available. You can go to my website at Medical Coding by Jen. You can book the workshop. You just go there under workshops. It's an easy tab. Once you get there, just hit the word book now. And then a calendar will show up. Just need to click on Sunday's date when that happens, which won't show up. You need to fast forward it over to the 15th and pick the date with the little dot there. Pick the date. Pick the time, which is 2 o'clock, and then hit next. If you want to watch it, it will be saved on Zoom for you guys for 90 days, so y'all can watch the replay even if you can't attend on Sunday. But it's going to be an overview of all 17 areas of any medical coding certification exam. Pretty sure. I don't think AHEMA or anything else will all be pretty much the same. They're all going to question you on the business of medicine, what kind of areas, and I'll show you what kind of notes you need to have and where I put them in my book for those particular answers. Like all those fraud ones. I've got the examples of fraud and examples of abuse written out differently in the front of the book before the E&M, that kind of stuff for those questions. So I think it'll be really good one to start off the year. And then February's and March and April's all will be like chapter related, like all cardiology or all E&M or all nervous system. We'll do more of those again. And each month we'll do one. But I hope this has been helpful. Thank you, Demi, for the roses. Thank you, MK. Thank you, Go-Kart. Always good to see you. MK, no more money from you, girl. If I can work you in, it's free. I just got to find some time. What are you doing this weekend? What are you doing tomorrow? I'll tell him hi, MK. We can chat on Discord too. You're welcome, Susanna. Thanks. Thanks, Rosalind. Nice visiting with you too. All right, guys, I'm going to close off this YouTube stream, and then it will be saved on YouTube, and y'all can rewatch the replay. I hope it's helpful. And